Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers. Half of the world's children have received life-saving vaccines from measles to Ebola since Gavi, the Vaccine Alliance, was created 25 years ago. The U.S. is now threatening to cut more than $1 billion promised to the nonprofit organization. Today, Dr. Seth Berkley, Gavi's former CEO, tells Stephanie Desmon what the consequences to health could be, not just in the world's poorest countries, but in the U.S. as well. Let's listen.
Seth Berkley, thanks so much for joining me.
Thanks for having me.
So today I want to talk about the latest threats to global health, and that is the threat to pull funding from the United States to something called Gavi, the vaccine initiative. And I'd like to just start, if you could tell us what Gavi is and what your affiliation was.
So Gavi, the Vaccine Alliance, is an amazing effort. And what it was is it started about 25 years ago. And the idea was to bring together all the key players in immunization and to try to have them work together, which is hard to do. But once you get everybody's consensus, it's a good thing, to try to bring new and underused vaccines to the world's children. And the way it was decided who would get Gavi's aid was the poorest countries in the world. So an economic threshold was set that has adjusted with inflation. It's $1,800 now. If you're below that as a country, you're eligible for Gavi support. And if you're not, then Gavi does have a program for middle-income countries, but it's mostly focused on these countries. Today, it's 56 countries. In the past, it's been as high as 74 countries. The other interesting part of it is that the countries pay something for the vaccine, even the poorest countries. And the idea there is not that it's necessarily a substantial proportion, but they get a hard currency budget that they year in and year out pay, and that helps build up sustainability. Eventually, they get richer across the threshold, and they take over the cost of their vaccines during that period because we buy vaccines for 50% of the world's children. The vaccines end up being much cheaper. They're about 98% reduction from the cost in the United States.
And you have statistics about how many lives have been saved by this program.
Yeah, so we vaccinated more than 1.1 billion additional children over the 25-year period, prevented about 19 million future deaths, and were able to introduce about 700 new vaccines to these countries. And the most important statistic, of course, is that we saw a 70% reduction in vaccine-preventable disease deaths, and that has contributed to a 50% reduction in under 5 child mortality. So a very successful program.
Yeah, and I'm not sure a lot of people understand sort of the scope of what you have done. You don't just deliver vaccines, there's a lot more to it.
Well, I mean, of course, at the end of the day, it's not about vaccines, it's about vaccination. And so when Gavi first started, the issue was there were new vaccines that were too expensive for countries to access, and yet that's where the need was greatest because they didn't have good health care. So it began to look at purchasing those vaccines. But of course, those vaccines need delivery systems. They need cold chain. They need to have trained healthcare workers, education materials. So it was a combination of all of those. So there's separate funding for health systems. There's funding for vaccine introductions when you introduce a new vaccine. There's funding for cold chain to build out those systems. And of course, all of that is important for not just the vaccines they're using routinely, but when there are outbreaks, or clearly a pandemic, you use those systems to deliver. So this is really about providing an end-to-end support for vaccines. And the last part of that that's important is that also we keep the stockpiles for infectious diseases. So things like Ebola, cholera, yellow fever, meningitis. So these are diseases that occur episodically, and the vaccines are available so that countries have them, and that is able to control those infectious diseases.
So it's been reported that all of the money that the United States gives to Gavi will be zeroed out. What fraction of Gavi is the United States? How much money are we talking about?
So first, I want to say that has been reported. There has not been a termination letter sent yet, and of course, we hope that that's not going to happen because we've had a lot of support over the years, bicameral, bipartisan, and the U.S. represents about 13% of the support of the organization. Of course, if it was to go to zero, that is a really big hit for something that the U.S. has been very supportive of. In fact, during the last Trump administration, President Trump actually increased support for Gavi, gave it a 5.5% increase, whilst many other of global health initiatives were cut. So there has been broad-based support for this. And of course, the challenge on this is that this is something that protects countries and keeps people healthy, but also protects the United States. So, for example, things like Ebola, if you stop the outbreaks in the country using the stockpiles, then that means that those aren't able to circulate, the disease isn't able to circulate globally. And so we have to think of it both as something to help and prevent disease in countries, but also to prevent the United States and the rest of the world from having infectious disease pandemics that can move around.
What would a cut like this look like? What would we see?
Well, then the first question would be, would others step up to fill in for this? Because obviously there's a broad set of countries supporting. The U.S. actually supports at less than their normal economic might as a country, which is something that is seen as good here. But would other countries step up? And of course, at this moment in time, because there's also increase in defense spending in many countries as a result of calls to do that, there is a lot of money that has been taken out of development arms. So if the whole amount got cut and none of it was replaced, the estimate is that about 75 million children would not receive vaccine over 5 years. And that's a big number in terms of children who ultimately would get infections and might die. And of course, the challenge with immunization is that we look for herd immunity, which is to try to have enough protection so that if one person doesn't get a take from the vaccine, they won't get infected because you've stopped the spread. If we go below a certain level, then you have a risk that diseases will start to spread more broadly and so will threaten a much larger percent of the population than when you've got these high levels of immunization that is currently existing in many countries.
And we're also talking about basic routine immunization, not just outbreaks.
Yes. But the reason I say that is, you take something like measles. Measles is the most contagious of all viruses. And we know that here in the U.S. as we're seeing an outbreak right now. And the challenge is if you get below a high threshold of coverage, you will begin to see outbreaks and epidemics from that, which is a routine vaccine. Other diseases, obviously, we're vaccinated against. Pneumonia, for example, is a disease that is not easily spread in an epidemic fashion, but it's a mixture of these types of vaccines. Same thing with yellow fever, which we give routinely as well. If you get below a certain threshold, then you can have yellow fever outbreaks that can move forward. So it has effects on individual disease, but also on dynamics of the community.
And vaccines are known to be particularly cost effective. Could you talk about that?
Yeah, absolutely. So if you look at vaccines, the thing about vaccines are they're preventive, first of all. And obviously preventing disease is better in general than treating disease. But if you look at the estimated cost-benefit ratio for vaccines, for the effects of the health that they provide, for every dollar you invest, you get a $54 return on investment. And that is just extraordinary and obviously a very good value. It's important for countries because this may not seem right. It may seem counterintuitive, but if you're a poor country, you have a much greater need to have these vaccines in place because you can't afford the illnesses that exist because you have very, very small health budgets. So getting that front, preventing these diseases, getting as many vaccines as you can into the population makes an enormous difference. As I said earlier, 70% reduction in vaccine preventable deaths. And this is how you're able to afford your other aspects of the health sector and treatment. And as you get wealthier, we do something called progressive universalism, which is, you start with the most cost-effective interventions. As you get wealthier, you add the next, least cost-effective, the next least. And so the idea is you expand your health system, but you get the maximum bang for the buck. And that's important when you have $8, $10, $50 for an annual health expenditure. So vaccines, in that sense, are the critical base for those health systems.
Could this mean on the ground? Like what are we going to see if this happens?
We're going to see really a number of things. One is we're going to see a large number of child deaths. And some of those will be, slow, painful, horrible deaths. And that will be unavoidable if we stop the vaccines. We will also see outbreaks of infection that will spread into communities that may not have seen those for a long time because they have been vaccinated. And that will also mean panic and effects that are broader than the individual family, because when you have an outbreak going on, one of the vaccines we brought in was a vaccine for the meningitis belt in Africa. Meningitis A, 50-cent vaccine. They used to have epidemics every 3 or 4 years. 10% of the population would get meningitis. This was devastating, would bring everything to a halt. We haven't had a case of meningitis A because of these vaccines now for almost 10 years. So you can see a return of those type of situations that can create chaos on where we are. And of course, at the end, you need healthy kids to learn and become the citizens of tomorrow. And if you make them sick and they end up with disabilities afterwards, common disabilities after, for example, measles or rubella, are deafness, blindness, other things that can create children that have an additional cost on society. So this is not a good thing in any way you look at it.
No, it feels like it's a change in how the United States has sort of dealt with the world. As a nation, we've come in and understood what the needs are of other countries in terms of health. And we've really tried to improve everybody's health all across the world. This seems counterintuitive.
The interesting thing here is that when you start with a very poor country, going back to the history of Gavi, these vaccines, when they originally come out, say in the United States, might be $200 a dose. And, the 11 vaccines that WHO recommends for use around the world are about $1,300 in the US. And by the way, they're not exactly apples to apples, but the same antigens. We get them at $24. And that makes it affordable to those countries. But the point would be that those countries could not get started if they didn't have that help in driving down the price by increasing the volume of purchase and the size of the market and interesting other manufacturers in it. So that's been the process that has been slowly done over 25 years. And this has had a dramatic effect on world health. As I said, more than it's contributed to the 50% reduction in child mortality that we've seen, increase in life expectancy, all of these things. But this is not about supporting their health forever. 19 countries have already graduated out of Gavi. Other countries are continuing to increase their spend. And the idea here is to give them a hand up, not a hand out. And this, to me, is some of the best development aid you can do, because you're both making people healthier, avoiding infectious diseases and epidemics, and helping countries step up so they can become better world citizens, better consumers, better purchasers of things. So it's a real win-win.
And I guess my last question is, what happens if the U.S. pulls out now? Will that damage all of the efforts? I guess what I mean is they're only 13%, but it seems like that taking that amount of money out could really be damaging.
Yes. So, every dollar taken out means less children vaccinated. It also means less new vaccines. We now have 2 vaccines for malaria for the first time. Those are new vaccines and haven't been funded in a serious way in the past. Malaria is one of the largest killers of children in the world. They started out very expensive, these vaccines. They're already coming down in cost. And the estimate is for every 200 children you vaccinate, you save 1 life. So really good vaccines. And so you're right. I mean, in a sense, you can say, oh, well, 13% is not the end of all of it. But what you do is you change the ecosystem, you change the view, and particularly the hardest part is the reliability. Gavi's been there for 25 years. It has never missed providing vaccines for people once they've had agreements for it. Of course, countries have graduated, and so they're not getting money from Gavi anymore, but it has been reliable. And if we change that, it's going to make countries say, well, maybe we don't want to take these vaccines, or maybe these vaccines aren't going to be critical for us.
Seth Berkley, thank you so much for joining me.
Can I add one other thing, which is I do have a book coming out on this topic called Fair Doses. It'll be up for pre-order in the next few weeks. And, that's about really trying to deal with understanding vaccine equity, but also what we did during COVID, which was a real lesson for the world. We were able to deliver 2 billion doses to 146 countries, but we also had many problems and barriers. And obviously, we need to learn about that for the evolutionarily inevitable next pandemic that's going to occur.
And what does this mean for what could this mean for future pandemics?
Well, it means that the pandemics are more likely to occur more quickly, and they're not going to have as good a response, because what happened, of course, in the past has been the system we had for delivery of vaccines was the system we built on. So during the COVID pandemic, the health workers who already were working hard and underpaid and having difficult circumstances, they delivered more than 3 times the number of vaccines they ever had before. And they delivered them to elderly populations and to healthcare workers and to people at risk. And that system managed it. We did lose about 5% of routine coverage during that period, but they continued routine vaccines. So these systems are the systems we need for the future for pandemics. And of course, if we don't have people vaccinated, it's going to increase the spread of infectious diseases, but also those teams, those people aren't in place, the systems aren't in place when we need them for the next time.
Seth Berkley, thank you so much for joining me.
Thank you for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Grace Fernandez-Cesiri. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer,